Welcome to Adapting Class. Antiplatelet, anticoagulant, thrombolytic. They shows up on the NCLEX all the time. They are hematological drugs. You have to be familiar for nursing school and for the NCLEX. Pharmacology Practice Test 13. We're going to use NCLEX practice questions and answers with rationale to understand them. And I'll give you some mnemonic on the way. Stick around and learn these medications so that you never go wrong when you see them. First question is to test your knowledge on anticoagulants. These are what the NCLEX will trap you, and they are teaching risk reduction question, which client statement indicate need for further teaching. They're saying something bad, and then scale for several clients on what? Anticoagulant. All of them are anticoagulant. If you're on warfarin, I will need weekly blood draw. Is it a good thing to say? Enoxaparin, I will need weekly blood draw. Is that right? Rivaroxaban, I will increase vitamin K diet. Is that okay? I will use electrical shaver instead of razor blade. Dipyridamole. Warfarin, I will limit intake of vitamin K rich diet. These are our statements from clients. Stop the video. Let me know what you think. But I'm going to give you the buzzwords and the key things the NCLEX will ask you. Warfarin, of course, I need to check your INR, right? Therefore, I need you to have your blood draw at least once a week. That is fine. Enoxaparin is an heparin. Heparin does not need blood draw unless it's IV form. Enoxaparin is a sub-Q form of heparin. You don't need blood draw. Rivaroxaban has nothing to do with vitamin K. It's not coumadin, but it's direct heparin inhibitor. Therefore, what is it going to do? You don't need any lab draw. Dipyridamole is the same thing. I will use electrical shaver instead of razor blade. It's a good thing because you're going to bleed. I will limit intake of vitamin K rich diet because I'm on warfarin. That's a misconception. You should not increase it. You should not decrease it. Consistent amount. Therefore, what is the key? If you're on warfarin, diet is consistent and you need lab draw. Other anticoagulants, you don't need any diet changes and no lab draw. Therefore, number 3, need intervention, further teaching. You should not change your diet. And number 2, enoxaparin does not need blood draw. And then warfarin, don't change anything, consistent amount. This question is big, it's high yield, and please love it. It's a good teaching. Please know it. What is the next priority action? That means what you do first. What do you do first? There's 2 questions with this particular question, same stem. I'm trying to teach you something. Priority, what do you do first? Client is on what? Heparin has developed platelet of what? 40,000. What does that mean? If you're on heparin and your platelet drop, we call it heparin-induced thrombocytopenia. What would you do if that happened? Do you continue heparin at lower dose? Do you stop the infusion? Do you check their GCS or increase fluid? Concept, test-taking strategy. The thing said priority. Priority means you have 1 second. What will you do? First thing you do. If I'm giving you a poison and it's making you sick, I should stop the poison. Continue at the lower dose, you still getting the poison. Assessing the GCS, you're expecting some bleeding in the head. That's why you're assessing that. Increasing your IV fluid, you still giving the poison. What you need to do, stop the poison. Stop the poison. The patient has developed heparin-induced thrombocytopenia. You need to stop it. Now let's look at the wrong answers. Continue heparin at lower dose, you're giving them heparin. You need to stop heparin completely. If you're looking for GCS, what do you think? You expect them to be bleeding. But heparin-induced thrombocytopenia, the major complication is not bleeding, it's thrombosis, stroke, and pulmonary embolism or DVT. Therefore, you're thinking otherwise. Of course, they may bleed, but number 1 is thrombosis. IV fluid is not helping. Stop the poison. What is the next best action? Same patient, same situation, but change the word best action. This is what the NCLEX will do to you. Same questions, and you're seeing different they change one word. You say, what did happen? I made a mistake. No, they testing something. The first one I said priority, which is the first. Now I said best. Best means what? You deal with the first thing, and now the best is the overall management of the patient. It's not the first, it's not the priority one, it's the best. Therefore, if you take in heparin and you develop low platelet, you have thrombocytopenia. What do you think the doctor is going to do? Continue heparin at lower dose, recheck your platelet, assess for your GCS, or give them dabigatran? Think about it. If you know this, put down in the answer choice. But this is a concept you have to know. When you develop heparin-induced thrombocytopenia, we stop all heparin and we give you other anticoagulants. That is the most important thing. That is the best action. The first action is to stop it, and the best action give you other form of anticoagulant. And that other form is dabigatran. Assessing for the GCS, like I said, you're looking for bleeding instead of thrombosis. Checking for platelet is not going to help you. And continuing heparin at lower dose, patient has heparin-induced thrombocytopenia. Stop it. If I said the first, you stop the medication. If I said the best, you treat them and give them dabigatran. So watch for that question. Six clients in emergency department present with left facial droop, slurred speech, and normal CT. Think about it. Connect the buzzwords. Connect the buzzwords. And let me know, what do you think? Left facial droop, slurred speech, and normal CT. What do you think? This is stroke. And what am I going to give you? Alteplase. If you're taking the NCLEX and they give you a case study on a stroke, you're going to get Alteplase. If you see a standalone question and you see a stroke, they're going to give you Alteplase. So know this question. I intentionally give it to you. This can be a full lecture. You'll see it on YouTube. That what are the contraindications for Alteplase in the patient with a stroke? Anybody who had surgery 4 weeks ago? Anybody who had brain surgery 6 months ago? Anybody with atrial venous malformation? Anybody with this blood pressure? Anybody with stroke 2 months ago? Anybody with recent surgery? The key is to know this. Take your pen and a paper. I want you to write this down. And don't forget, contraindication for Alteplase. If you have surgery 4 weeks ago, it's enough. All you need is 2 weeks. Abdominal surgery. If you have brain surgery, you need at least 3 months. If you have atrial venous malformation, that's bad. That is going to cause bleeding. You should have uncontrolled hypertension. If it is, you're not going to get it. This blood pressure is good. If you had stroke, it should be more than 3 months. This patient had stroke 2 months ago. We have a problem. If I say recent surgery means just now. It does not matter what time. Recent remain recent. Recent surgery is bad. Therefore, recent surgery, stroke within 3 months, uncontrolled hypertension, atrial venous malformation, brain surgery within 3 months, abdominal surgery within 2 weeks. These are the things you have to know, and they're going to show up on the NCLEX. Which of the following drugs should the nurse suspect may be prescribed as antiplatelet therapy? Select to apply, and nurse attend a staff education on antiplatelet medication. You have to know them. You have to recognize them. You have to be able to see, said, oh, these are antiplatelets. What do you think? Which of these is antiplatelet? Yeah, I know you know aspirin. Maybe you know about Clopidogrel, but do you know about Tachygrelol or Pentoxifylline or Dipyridamole or Prasugrel? What do you think? Are these anticoagulant? Are these antiplatelet? Are these thrombolytic? I give it to you. All are antiplatelets. How do you recognize them? This is your mnemonic. The mnemonic to remember them is this. This you shouldn't forget. A cool, tiny platelet drop pieces. Therefore, each letter represents the medication. A for aspirin, C for Clopidogrel, T for Tachygrelol, as you go down. P for Pentoxifylline as you go down. Remember them, a cool tiny platelet drop into pieces by these medication. That's the acronym to remember all the antiplatelet. And the big one is aspirin, Clopidogrel, Antidote, and then Pentoxifylline. Don't forget about them. Note them. Which medication should the nurse expect to administer? A client receiving heparin infusion start hematuria, side effect of heparin. You bleeding because you get a heparin. You have overdose heparin. When you bleed from heparin, means you have overdose. What is the antidote for heparin? Protamine sulfate, vitamin K, warfarin. You see, atropine is off. Now you're left with warfarin, vitamin K, and protamine sulfate. Vitamin K and warfarin are friends. Therefore, A is your right answer. You see, that's the easy way to learn these things. Protamine sulfate is the antidote for heparin, and vitamin K deal with warfarin. Therefore, what do you think? H2P and VNK, those are the acronym to remember. HMP, heparin and protamine sulfate are friends, and vitamin K and warfarin are friends. Number 7, a client taking warfarin asks about dietary restriction. Which food should the nurse teach the client to ensure consistency? The key word is warfarin, and the key word is consistency. What is warfarin going to do? Bind to vitamin K dependent factors. Which of these contain high level of vitamin K dependent factors? Not orange, not potatoes, no chicken. It's usually what? Spinach. Therefore, which one we should ensure to have consistent amount? That's number 2. That's all you need to know, because it contains a bunch of what? Vitamin K dependent factors. So number 2 is your right answer. A nurse is monitoring a client on warfarin. Which laboratory results indicate the medication is therapeutic? When you're warfarin, I need your INR to be what? 2 to 3. Which of these is 2 to 3? Number 3 is your right answer. These are straightforward questions, but easy to mix. So I just want to make sure you know them, and then we talk about them. And then prepare to administer Enoxaparin, Lovenox. What is the correct site? It's given a sub-Q. What would it be? Sub-Q. Deltoid is not a sub-Q. Pistalis lateralis is not a sub-Q. Glute muscle is not a sub-Q. Test-taking strategy. Number 3 is your right answer. And hence has provided teaching to a client, prescribe Clopidogrel. We saw it. It's an antiplatelet. Which client statement indicate a need for further teaching? It's a bleeding medication. Therefore, if they say something they don't understand, well, that's what you pay attention to. I will call with dark stool. I will avoid green leafy vegetables. I will take acetaminophen for knee pain. I will use soft bristle toothbrush. Causes bleeding. Using soft bristle toothbrush is good. I will use acetaminophen for knee pain. I don't want to bleed. I will avoid green leafy vegetables. It's a bad idea. There's no need to change anything when you're Clopidogrel. I will call with dark stool. You blink, you bleeding. Therefore, patient does not understand number 2 because they think they can change their diet. In Clopidogrel, it's an antiplatelet. Therefore, no diet modification. And this is caring for a client with anemia. Prescribe ferrous sulfate, iron. Know this because it's common. A lot of people are on it. And class will ask you. These are little questions you don't want to miss. What do you think? Which teaching is most important? Take it with milk, expect dark stool, stop it if you're constipated, and avoid vitamin C. All are trap answers. Trappy answers. Number 1, you should avoid it taking it with milk. It affects absorption. Number 4, vitamin C rather help with absorption. So you should rather take it with vitamin C and avoid milk. Stool, dark stool is expected finding. That's what iron does. I'll give you the mnemonic. It's going to cause constipation. Therefore, which is the most important? Expect dark stool. But what is the keyword? Dark stool are expected. Milk reduces absorption and vitamin K enhances absorption. But what is the mnemonic I want you to take with you? Iron, I'm rusty. Stool is going to be rusty black. That's the buzzword. And hence knows the treatment is effective when which is finding it occur. And next, administer vitamin B12 injection to a client with pernicious anemia. That means they have what? Pernicious anemia due to vitamin B12 deficiency. That's a megaloblastic anemia. If patient is anemic, what do you think they're going to do? The question is asking you effective. That means there's improvement in the anemia. Reduce fatigue, increase appetite, absence of bruising, and increase urinary output. What do you think? Fatigue is consistent with anemia. This question is not testing anything, just to tell you they will give you questions like that. That is straightforward. Pernicious anemia, you have fatigue, you get tired, you have shortness of breath. Effective teaching, I'm going to do better. Reduce fatigue. 13, which prescription should the nurse anticipate from the provider? What do you think you should expect? An escape for a client with what? Moderate claudication. 13 questions. How many have you answered so far? I know you get 13 out of 13. Put down your score down. I want to check your score. I will watch this video multiple times and see how many people put their score there. Don't be shy. Put it down and let me know how many you check it. But these are hematology questions. You have to be able to identify them. And do not make the question too hard and make it concept-based. That when you know the concept, the answer choice is right there. Claudication. What medication will you give? Remember that in claudication, we want to improve blood flow, right? I see Warfarin, I see Pentoxifylline, Enoxaparin, and Dipyridamole. There's a test-taking strategy here. Do you see it? Put down your answer choice. Let me know. If you're taking this test, I want you to use this test-taking strategy. There's 3 anticoagulants there, and there's 1 antiplatelet. Something should tell you that all the 3 anticoagulants are wrong. Warfarin, Enoxaparin, Dipyridamole are wrong. The right answer is Pentoxifylline. Why? It's an antiplatelet and increase red blood cell flexibility and decrease blood viscosity, and they allow blood flow. So patient with claudication, expect them to have Pentoxifylline. Know this medication. It's a good test-taking strategy and a drug that to be aware of. A client prescribed with folic acid. You have to know, given to pregnancy, it's a folate. What is the purpose of it? To prevent your blood pressure, to help your baby spinal cord develop properly, to prevent gestational diabetes and reduce morning sickness, of course. Neurotube defect. Which one is neurotube defect? Do you see any neurotube defect there? Spinal cord development properly. That's the key. And the last quick. And nurse is preparing to administer IV iron dextrose. Remember, iron, we have oral form and IV. If we have to give you 2 IV, you got to be careful. It's very dangerous. It's very dangerous. It's very dangerous. I'm giving you a clue. What is the priority next action? Don't flush IV with heparin. Administer a small test dose. Mix it with the vitamin C and give IV in the deltoid. You use the vitamin C with the oral form, but not IV form, right? This is an IV. It cannot be IM injected in the deltoid. You're left with 1 and 2. If you don't need to flush heparin, right? Give them small dose because it can cause anaphylaxis. So the right answer is iron dextrose can cause anaphylaxis. Therefore, small dose until you know the patient is doing well. 15 questions, NCLEX practice question, test-taking strategy, pharmacology review, hematology drugs, antiplatelet, anticoagulant, thrombolytic, and key concept. I know you mastered them. Watch them with this video multiple times, take notes, and you will see these questions on all these drugs. Take care of yourself. One video for you to master all anticoagulant. Take care.